Mr. Speaker, economic transformation is ultimately about people. A healthy, educated, skilled, and productive population is indispensable for sustained growth and shared prosperity. That is why government continues to allocate a large share of the discretionary budget to human capital development, i.e. health, education, water and sanitation, and social protection. During financial year 2025-2026, the following milestones were achieved. Under health, Mr. Speaker, government sustained its policy of progressively increasing investment in essential medicines and health supplies. Accordingly, funding through the national medical stores was increased by Uganda shillings 145.33 billion to Uganda shillings 862.93 billion in financial year 2025-2026. Government will continue to increase domestic financing for essential health commodities with the aim of substantially reducing reliance on donor support. This will guarantee uninterrupted access to essential medicines like antiretroviral medicines, anti-malarial drugs, vaccines, immunization supplies, laboratory commodities, and anti-tuberculosis medicines. Government continued to modernize healthcare infrastructure and equipment. During the year, 17 regional referral hospitals and 25 general hospitals were equipped with neonatal intensive care units. In addition, 14 regional referral hospitals received CT scan machines. Construction and upgrading of 31 health facilities across Karamoja is ongoing. Government also completed high-capacity medical waste incinerators in Fort Portal, Guru, Mbarara, KCCA, and Lira. Busorwe, Gombe, Kaworo hospitals were also rehabilitated. Right Honorable Speaker, government continued to promote preventive health care through immunization, disease prevention, and nutrition programs. Immunization coverage for children under 1 year reached 94%, while first dose measles, rubella coverage reached 93%. Government also conducted nationwide campaigns against malaria, HIV, AIDS, Ebola, cholera, and yellow fever, and promoted nutrition education for children, pregnant women, the elderly, and other vulnerable groups. Government also continued to expand specialized healthcare services in oncology, cardiology, and other fields, reducing the need for treatment abroad. The Uganda Heart Institute conducted 634 cardiac interventions, including open heart, closed heart, vascular, and catheterization procedures. In April 2026, the Uganda Cancer Institute successfully performed the country's first bone marrow transplant. Mr. Speaker, specialized health care services will be further strengthened by ongoing investments. The 250-bed capacity cardiac hospital in Naguru, Kampala is 44% complete and expected to be completed by June 2027. The International Specialized Hospital of Uganda at Lubowa is 75% complete and will be completed in December 2027. Mr. Speaker, I wish to repeat this one. The International Specialized Hospital of Uganda at Lubowa is 75% complete and will be completed in December 2027. The first phase of the Nuclear Medicine Center for the cancer treatment is 95% complete with radiotherapy and advanced molecular imaging services. Phase 2 of the PET Center is 10% complete. Regional cancer centers in Mbarara, Arua, and Mbale are under construction, while the Guru Center is fully operational. Other achievements in the health sector include: 1. Expansion of the national e-health digital infrastructure to support telemedicine, health information management, medicine tracking, and monitoring of health workers' performance. Number 2, strengthening the national ambulance and emergency care system through the deployment of additional ambulances. Mr. Speaker, the priorities under the health sector for financial year 2026-2027 are the following. Government has allocated Uganda shillings 5.23 trillion for the health sector in financial year 2026-2027. The funding will focus on: number 1, maternal and child health; 2, nutrition improvement; 3, expanded immunization; 4, prevention and treatment of non-communicable diseases; 5, provision of essential medicines; 6, strengthening specialized healthcare services; 7, improving emergency response systems; 8, exploring feasible pathways towards universal health coverage. I now come to water and sanitation. Mr. Speaker, access to clean and safe water remains fundamental to public health, human dignity, and economic productivity. Government has therefore continued investing heavily in water supply and sanitation infrastructure across the country. Access to improved water sources continues to expand, with 71% of households now having access. Coverage stands at 68% in rural areas and 74.5% in urban areas. Mr. Speaker, during financial year 2025-2026, safe water access was extended to 553 villages. Over 200 large solar-powered water and sanitation systems, several public sanitation facilities, and fecal sludge treatment plants were completed in several districts. In addition, a number of urban water systems were expanded. Government has allocated Uganda shillings 1.013 trillion in financial year 2026-2027 to further expand access to safe water and sanitation services across the country. The objective is to ensure universal access to safe water and sanitation services. I now come to education, skills, and sports. Mr. Speaker, education remains the most powerful instrument for social mobility and long-term economic transformation. During the financial year 2025-2026, the following milestones have been achieved in the education sector. 1, in order to expand access to education, government continued financing universal primary education (UPE) and universal secondary education (USE). Approximately 9.52 million learners benefited from UPE, while about 995,116 learners benefited from universal secondary education, and universal post-O-level education and training. 2. Government completed construction of 90 additional seed secondary schools, expanded 54 existing schools, and operationalized 259 seed schools. 3. In preparation for AFCON 2027, Hoima Stadium has been completed, upgrades to Nambole Stadium are progressing well, and other required tournament facilities remain on schedule. Further construction of Akibwa Stadium is on schedule. Number 4, government has intensified investment in STEM, technical and vocational education, industry-linked skills development, and digital literacy. In financial year 2026-2027, priorities for education, skills, and sports, Mr. Speaker, are the following. Next year, government has allocated Uganda shillings 6.66 trillion to further improve education of Ugandans. Priorities will include: number 1, access to quality UPE and USE. Number 2, strengthening STEM and vocational education. 3, improving teacher welfare and training with emphasis on pre-primary teachers. 4, curriculum reform. 5, strengthening public universities and research institutions. And 6, completing critical sports infrastructure for AFCON 2027. Mr. Speaker, beginning financial year 2026-2027, an additional Uganda shillings 568.65 billion has been allocated to enhance salaries for primary school teachers and arts teachers in secondary schools and BTVET institutions. I now come to social protection and inclusive development. Mr. Speaker, the NRM government has over the years ensured economic growth is inclusive. Government continues implementing targeted programs aimed at supporting vulnerable groups and expanding economic participation. The following are some of the achievements. 1, government has continued to support older persons through the Social Assistance Grant for Empowerment SAGE, which has cumulatively reached 489,673 beneficiaries, with a total of